finals. I had like 3 finals and I just can't handle it. That's weird. Ooh.
Hi, how are you today?
I'm good. How are you?
Good.
Auscultation is a way for medical professionals to examine their patient's heart and lung function by listening to the sounds in the chest using a stethoscope. This is usually done at the beginning of a routine physical exam, but is especially indicated for patients with expected respiratory or cardiac conditions.
What are you doing with that?
This is a stethoscope, and I'm going to listen to the rate, rhythm, depth, and character of your respiration before we begin the exam.
When auscultating a patient, you need to be in a quiet environment and have your patient in a seated position. Always auscultate over bare skin.
Is it all right if I pull your shirt over and put this on your skin?
Yeah, sure.
Okay, Lauren, I'm just going to have you sit up straight and breathe normally.
All right. Ooh, that's cold.
Oh, I'm sorry.
Don't forget to warm the stethoscope before you put it on the patient.
It is important to use a systematic approach when auscultating your patient. This is the order of auscultating lung sounds. Auscultate one side and then the other to compare lung sides. Some abnormal breath sounds include crackles, rails, pleural rubs, wheezes, bronchi, and stridor. Crackles indicate asthma, bronchitis, interstitial lung disease, and early congestive heart failure. Pleural rubs indicate pneumothorax or pleural effusion. Wheezes indicate chronic obstructive pulmonary disease, asthma, chronic bronchitis, congestive heart failure, and pulmonary edema. Bronchi indicate larger airway obstruction by secretions. And lastly, stridor indicates obstruction of the trachea or larynx and is a medical emergency, and 911 should be contacted immediately.
Okay, Lauren, now I'm going to listen to your heartbeat.
Okay.
There are 4 locations of the heart where we need to place the stethoscope and listen to the heartbeat: the aortic, pulmonic, tricuspid, and mitral. The stethoscope has a larger diaphragm, which is good for listening to high-pitched sounds. It also has a smaller bell, which aids with the hearing of low-pitched sounds. Normal heart sounds include S1, lub, S2, dub, S3, lub dub D, S4, D lub dub. When auscultating heart sounds, there are special considerations to keep in mind. S3 or 4 is normal in athletes. S3 may be normal up to age 40 and during the last trimester of pregnancy. S1 is the sound of the closing of the mitral, tricuspid valves and is heard when systole begins. S2 is the closing of the aortic, pulmonic valves and is heard when systole ends. S3 may suggest heart failure and diastolic dysfunction. It is also known as ventricular gallop. S4 indicates or may indicate hypertrophic ventricle and is also known as atrial gallop. Auscultating a patient before treatment is important because listening to the sounds of the lungs and heart can help aid in the process of diagnosis and treatment. In conclusion, abnormal sounds will tell us if the patient will need more medical attention for treatment, so make sure you auscultate your patient correctly and carefully.